Good afternoon. This is Joanne Spetz at the University of California, San Francisco, here with colleagues to present our annual webinar on the nursing labor market in California. Thank you very much for everybody being here. I'd like to introduce our group of panelists for today. There we go. So today's presenters are myself. I'm Joanne Spetz. I'm at the Philip R. Lee Institute for Health Policy Studies at the University of California, San Francisco. And with me, I have Terry Hollingsworth, who is the Vice President of Human Resources Services at the Hospital Association of Southern California. Garrett Chan, who is the President and CEO of HealthImpact, and he is also an Associate Adjunct Professor here at UCSF. And David Auerbach, who is the Director of Research and Cost Trends for the Interdisciplinary Health Workforce Studies Center at Montana State University. We have several goals for today. We want to learn about how chief nursing officers perceive the current RN labor market. We will track the latest hospital and vacancy and turnover data. We want to talk about how recently graduated nurses are faring. And overall, we want to bring this information together to answer the question of whether there is an RN shortage in California now or will there be one in the future. Then we'd like to discuss some next steps and strategies for ensuring an adequate nurse supply. For some context, we certainly have seen a lot of news over the past couple of years about potential for nursing shortages and concerns, particularly from hospitals, but across settings, about there being a nursing crisis or difficulty in recruiting staff. This has been interesting to watch because at the same time, national federal forecasts and other local state forecasts generally suggest that the labor market is producing adequate numbers of nurses. So this produces a bit of a conflict about what's going on, and thus we've been engaged in surveillance of data across a variety of different sources to try to understand what's happening specifically in California. But as we will discuss later, what we're seeing here also resonates across other states in the US. So let's begin by looking at what we have learned from chief nursing officers in a survey that UCSF conducts every year. We've been doing a survey of chief nursing officers. These surveys have been conducted since fall 2010 and were initially designed to look at what was happening to the demand for nurses during the recession. This is a web-based survey with an option to return a paper survey via fax or email. And in 2018, we received data that represented 118 hospitals. So this was about a 26% response rate. In some years, especially 2010 through 2012 or so, the response rate was closer to 40%. And of course, we encourage any of you who are chief nursing officers to do this survey when you receive it this next fall, because this information is really important to understanding what's happening in your region and helping policy leaders and educators meet your needs. One of the questions in this survey is to ask chief nursing officers on a scale of 1 to 5 to rate their perception of the labor market in their region. And that scale ranges from 1, which would be high demand and it's difficult to fill open positions. I'm sorry, that's the 5. And that is in this chart. Let's see, in this chart, that would be the dark blue. Moderate demand is some difficulty filling open positions, which is the kind of turquoise blue. And then through the hot pink is that the demand would be much less than supply available. So the bars on the right indicate a surplus of nurses and the bars on the left indicate a shortage of nurses. As you can see, in 2010, when we began these surveys, there were more hospitals reporting a surplus of nurses than a shortage. But by the time we get to about the past 4 years, we have the vast majority of hospitals reporting that they perceive a shortage of nurses in their region, and very few hospitals saying that they perceive any surplus of nurses in their region. Now, there are important differences across regions in the overall labor market. So these are data for different regions of California. The southern border regions are San Diego and Imperial counties. The Inland Empire is Riverside, San Bernardino. LA is defined following the Census Bureau of LA, Orange, and Ventura. Central California includes the Central Coast and the Sierra. San Francisco Bay Area covers the Bay Area, including Santa Cruz County. And then Sacramento and North, I know, is a terribly large area, but given response rates, we kind of have to group that all together. What you can see in the data is some regional variation, with the perception of the shortage being generally less in the San Francisco Bay Area and somewhat more in Central California and the southern border counties. But for the past several years, we have also asked nurse directors to tell us what their different experiences are for experienced nurses. And what we've seen over time is that for experienced nurses, hospitals have been reporting a pretty significant shortage, especially since 2014 or 2015. And again, that varies across regions. It's less of an issue in the San Francisco Bay Area and more of an issue in most of the other regions of California. This contrasts quite notably to CNO responses for the degree of shortage for newly graduated nurses. Now, a score below 3 would indicate a surplus of nurses, and as with previous years, in 2018, in nearly every region, employers reported that they perceived a surplus of newly graduated nurses. This surplus is less of an issue in the Central California region, where actually hospitals reported on average a balanced labor market. And then Sacramento and northern counties and southern border counties also indicated perhaps less of a surplus of new graduate RNs. But San Francisco, LA, Inland Empire, all on average, the CNOs are reporting a pretty notable surplus of newly graduated nurses. There are some differences between rural and urban regions, with rural hospitals being more likely to report a shortage than the urban areas, and this has been pretty consistent over time. In the survey of chief nursing officers, we also ask about employment of temporary and traveling nurses. Statewide, more hospitals reported lower use of traveling nurses over the past year compared to the prior year, while the use of local temporary RNs appears to have been fairly stable. So there's a little bit less use of traveling nurses, which is, I think, important in thinking about the degree of shortage that hospitals might be experiencing. CNOs also are asked about international recruitment, and as you can see, international recruitment has increased over the past few years. Last year, when the data came in at 9.7%, it was a little unclear to us whether that was because the group of hospitals that happened to respond that year were more engaged in international recruitment, or it was the beginning of a trend. Now that we have 2 years of data, I think it's possibly the beginning of a trend. But we'd like to note that the hospitals that reported that they were doing international recruitment, they were almost all in the Inland Empire area. There were a few in the Los Angeles region, one in Central Valley, one in the southern border region. So those 118 hospitals, almost all were Inland Empire. This is consistent with the perceptions of a shortage of experienced registered nurses, but it isn't consistent with the perception that there's a surplus of new graduates. Unfortunately, we don't have data about, for this international recruitment, whether that international recruitment is aimed at experienced nurses that are able to fill the specific kinds of experienced nurse roles that are in shortage versus broad-based international recruitment. And that's something that is worthy of some more exploration to better understand what's going on. In thinking about the context of newly graduated nurses, CNOs were asked about their hiring requirements and preferences. About 18% said that they have no specific hiring preferences, which was similar to 2011. It's generally been somewhere around 50 to 60% say that they, around 18 to 21% say that they have no specific hiring requirements. There was a notable increase in the percentage that reported that they require a bachelor's degree this year compared with prior years. In the past, that share was fairly stable at around 5%, and this year it was up to 18%. The hospitals that were reporting that they required a bachelor's degree for their new open positions were almost all in the Los Angeles, San Francisco, and southern border regions. Now, these are regions in which larger hospitals seem more interested in pursuing magnet status, and nationally, this tends to happen in regional clusters as part of hospitals that are really competing against each other for patients and for experienced expert nursing staff. There was some decrease in the percentage of hospitals saying that they preferred a bachelor's degree, probably in part because some of those hospitals shifted from a preference to a requirement. And the percentage of hospitals with a minimum experience requirement has been fairly stable, with about half of them having that requirement. Chief nursing officers were asked about their hiring expectations for the next year, and as has been the case since around 2013 or so, more hospitals report that they plan to increase their hiring for the next year than indicated that they plan to decrease their hiring over the past year. We have more than half say that they expect to do more hiring than last year. They are also asked about their hiring expectations for new graduates, and nearly 1/3 expect to increase their hiring of newly graduated nurses over the next year, while only 9% expect to decrease their new grad hiring. For those that say they plan to increase their new graduate hiring, they're asked why. The most common reason was high vacancies. Other common reasons were that they are anticipating more requirements and want to do some hiring in preparation for that they're developing programs to mentor new graduates, and that they've improved relationships with nursing schools, including collaborations on residency and onboarding programs. So now I'd like to pass it over to Terry to talk about the latest hospital vacancy and turnover data.
Great. Thank you so much, Joanne, and good afternoon to everyone. Again, my name is Terry Hollingsworth, and I'm the Vice President of HR and Education Services with the Hospital Association of Southern California. And just to give you some background on the association, HASC is the regional trade association that represents the interests and serves the political and economic and education needs of over 180 hospitals across the Southern California region. Today, the information that I'll be presenting to you comes from the third quarter of 2018 Healthcare Workforce Report that is completed by Human Resources departments in hospitals across the state. In the fall of 2018, 244 hospitals participated in the survey, and today I'll be presenting to you highlights of the report. On this first slide, describes RN vacancies. In 2018, we saw a decline in the average RN vacancy rate back down to the 2013 level of 4.2%. In comparing 2015 to 2018, we saw a marked increase in participation of larger hospitals and health systems participate, which could have influenced the decline in the 2018 vacancy rate. Another factor influencing this decline might be that hospitals are implementing more effective and efficient talent acquisition and retention strategies that focus on finding the right people with the right skills. These strategies would ultimately help minimize turnover of the existing workforce. Next slide, please. Slide 2 describes the quarterly hiring of full-time personnel. As you can see in the three categories, staff RN, other RN, and LVNs, the data shows an increase in hire rates. As Joanne previously stated, the demand for nurses in hospitals remains strong. Just to touch on the other RN category, and this category includes registered nurses who do not provide direct patient care, but serve in other capacities that are being utilized throughout the hospital beyond the bedside. And some examples of these other RNs would include patient safety navigator, transition of care coordinator, and orthopedic center coordinators. So these are all nurses that are being utilized in other capacities within the hospital. The same would be true for LVNs, and we're seeing an increase in the hire and utilization of LVNs. However, this is not, they're not necessarily being utilized in the acute care setting, but more so in the home health, hospice, and other non-acute settings affiliated with the hospital. Before you advance forward, I just wanted to note one more thing that's not included on this slide about the hiring of new grads. During the third quarter of 2018, the new grad hire rate was 29.4% on average of hospitals. To give the audience an idea of what this means and to quantify this a bit more, this would be 146 hospitals reporting that they have hired a total of 665 new grad RNs, and this trend quarter over quarter around 600, 500 to 600 per quarter is pretty consistent and has been consistent over time. So I just wanted to call that out. Next slide. Regarding quarterly turnover and full-time personnel, on this slide we're seeing a decrease in turnover for staff RNs and other RNs and a slight increase for LVNs and aides. For LVNs and aides, again, this may be due to hospitals determining how to best utilize these roles with the right people to fill them. One note, again, that's not on this slide, but an important observation that we've made looking at the data is that in the fourth quarter of 2018, hospitals reported that on average, 42% of new grad nurses terminate within the first 2 years of employment. Now, although the survey does not probe and ask the hospitals why this is occurring, what we've been hearing is several reasons, including lack of support from nurse administration, burnout, stress, not feeling adequately prepared for the demands of nursing, and overall job dissatisfaction. So just wanted to note that regarding the new grad RNs. And that's it for me, Joanne.
Great, thanks, Carrie. And now I'll hand it over to Garrett Chan with HealthImpact to talk about their survey of recently graduated nurses.
HealthImpact is the California statewide nursing center. And so we've been doing a new employment survey of new grads beyond just the hospitals since the recession in 2010. What we've been seeing in the few years leading up to 2013, we found that the challenges that were faced by the newly licensed RNs in finding employment was improving over time. So the last survey that we did, spanning from September 2017 to August 2018, we sent out a survey in collaboration with the Board of Registered Nursing of a random sample of 50% of 10,600 newly licensed RNs during that time period. We did receive a response rate of 21.5%, which is about 1,100 nurses reporting back on the survey. So next slide. What we've seen since 2010 is an increase in the new graduates reporting that they have found a job during the study time period. In 2010, we saw that there were 57% new grads reporting that they were able to find a job after graduation, with a peak in 2016. In our last survey of 2017-2018, we saw that the rate decreased a little bit to 80%. So 80% of new grads who were reporting that they have found employment were reporting in the positive. We are not clear why there is a decrease. There are many potential reasons for this decrease down to 80%. One could be that the study period starts in September, and so new graduates who just received the survey and are reporting back may not have found a job in such a short period of time. And But we do see that there is this improvement in the overall new graduate employment landscape. Next slide. So we see some regional differences, and this pattern is consistent with employers' perceptions. We see that in the San Francisco Bay, 30% of new graduates are reporting that they're not employed. And this is, to Joanne's earlier slides, reflects that there could be a surplus of new grads with fewer vacancies. We do see that there is the highest employment in the Central Valley and Central Coast, where there are the biggest shortage areas. So this is where we're matching the supply of new graduates with the demand for nurses in those regions. In the next slide, we are reporting out here in this slide just associate degree and bachelor's BSN students. We didn't have enough for the entry-level masters to report out in a statistically significant way. But what we found that in the recession, the years post-recession, 2012, 2013, that respondents were for BSNs were finding jobs more readily than ADN graduates. As of last year, we see that the ADN and the BSN nurses are getting employment at similar rates. And so this difference has seemed to have faded statewide. So in the next slide, we want to understand where are people being employed, these newly licensed graduates. And so what we see is that about 60% of new graduates statewide have been able to find employment in the inpatient hospital setting. And then about 65% of new nurses are in either a hospital inpatient unit or a hospital outpatient department. We are now seeing that there's a lot more outpatient departments represented in the new graduates, such as in community clinics, long-term care, rehab, behavioral health, home care, corrections facilities, and others. We see that 10% in the long-term care rehab arena is higher than statewide average shares of RNs in these settings. So comparing newly licensed RNs, they're getting more employment in long-term care and rehab facilities compared with the general RN population. And this is actually an opportunity for us to look and see how we're educating nurses to meet the needs and the clinical practice of departments outside of the hospital, but also seeing that about 15% of newly licensed RNs are finding positions in hospital outpatient departments. And so thinking about what is the educational preparation and how we're educating nursing students in their pre-licensure programs to pick up the practice in these settings. So I'm gonna pass the baton back to Joanne.
Thanks, Garrett. It is interesting that the data aligns so well in terms of where the new graduate nurses are most likely to be hired and where the employers are saying they're most likely to be experiencing even a tight supply of new graduate nurses. It helps to corroborate our data, which is really useful when we're trying to understand what's happening in California. So with this information and other data, we can try to look at the question of whether there is a shortage in California of nurses and will there be one in the future. I think the data that we've looked at so far about vacancy rates, what chief nursing officers are telling us, and what newly graduated nurses are telling us says that it depends on whether you have experience as a nurse and whether you're looking for experienced nurses and where you're located in California. So first, I want to put some context around what's happening with RN graduations annually in the state. As many of you know, California and the rest of the United States faced an extremely deep and severe shortage of nurses that began around 1997 or 1998. And that was the period of time where the federal government released a forecast that said we were going to have a shortage of more than 1 million nurses. And what happened was the market responded. Nursing schools expanded. In California, our legislature gave more money to our nursing schools. There were grants given to schools, and deans and directors, to their credit, worked really, really hard to more than double the number of graduates. If I took this data back to 1998, you would see that we more than doubled the number of graduates in our state over a fairly short time period. And fortunately, nursing schools have been able to maintain those graduations over the past 7, 8 years, even through the recession, when I think many of us were concerned that they would have difficulty maintaining their finances and keeping those enrollments up. In the Board of Registered Nursing's survey of nursing schools, the annual school survey, deans and directors are asked to report what their expected enrollment is for next year and for the year after that. And we use that to project future graduations. As you can see, the projected future graduations are going to remain fairly stable. That will be probably around a little over 11,000 graduates per year for the foreseeable future. So there are some changes that affect these preliminary 2019 projections that are built from the projections that are published by the Board of Registered Nursing. There are more nurses that have been requesting endorsement into California, but almost all of those nurses have out-of-state addresses. So what we don't know is whether they're going to permanently move here or whether those are traveling nurses who are here temporarily for some reason. Let's see, we also, when we looked at this, and so when we looked at how to use those data, we largely focused on the newly licensed nurses with California addresses, and that produced numbers that were a little lower than the last projection model. So I'll be the first to say that our estimates in this preliminary projection of nurses moving to California from other states is probably too low, which is why I produced a range of plausible estimates. There also was a small increase in the number of international graduates moving to California, but we are still under 1,000 international graduates, well below the numbers that we had in the nursing shortage more than a decade ago. The international graduates that are requesting endorsement or coming into California now also appear to be a little bit older than historically they have been, which might suggest that the international recruitment that is occurring is more focused on experienced international graduates. There appears to be fewer nurses moving out of California. It's a very small change. And there also appear to be slightly lower employment rates for most age groups in the current survey data, but those differences are not huge and don't affect the models a lot. So this is the bottom line in the preliminary projections, and I'm going to emphasize the word preliminary. And there are a few things that are worth noting here, because these still do need some fine-tuning, but in general, they continue to indicate that we are largely on track to have an adequate supply of nurses statewide in California. Now, note on the orange dashed line at the top, that would be a high supply forecast, and then the dotted orange line towards the bottom is the kind of low supply forecast. We could have a low supply forecast if nursing schools shrink even a little bit and more nurses leave California and all those nurses requesting endorsement never move here. And on the high side, if all of those nurses requesting endorsement were to actually move here and we were to have continued growth of nursing education programs, and not many nurses leaving California, we would be on a trajectory towards that higher supply forecast. Now, of course, that's a wide range, and that's because with all candor, there are a lot of things that affect how these forecasts and how our supply could play out when you're looking 15 years into the future. So when we look at the data, though, we've got the green lines, which are the estimated demand. The dashed line is if we were to attain the national 25th percentile of RN FTEs per population. Now, California has never been at that level. We have usually been around number 46 in the country, and there's debate about whether that's where we should be or shouldn't be. But if you do an alternative projection of largely wanting to hold steady but adjusting for the aging of our population, you end up with that solid green line. And as you can see, we're largely, the supply and demand are almost exactly on top of each other, with the best supply forecast perhaps being a little bit lower, but a very small amount lower. Now, statewide is fine and dandy, but California is a huge state. If you took California and cut it out and laid it on top of the East Coast, what we're talking about is basically New Jersey to South Carolina. So statewide forecasts in a state that big is not tremendously helpful. There is research that has found that half of registered nurses live and work within 40 miles of where they went to high school. So this is a very mobile workforce internationally, but it is also a very local workforce. So these regional differences are very important. And these are forecasts that were published by HealthImpact last December that showed that there are notable differences across the regions of California, with some regions like the Los Angeles area with projected surpluses of nurses, and other areas like the Central Valley and Central Coast with projected shortages of nurses. These models tried to account for commuting across regions and the extra demand for nurses that might be indicated when hospitals are employing a lot of temporary nurses. But they do tell us that these regional differences are very important and what we really should be paying attention to. And that's very consistent with the data that Garrett showed, as well as the other data that we've seen so far today. So I want to hand this over to David Auerbach to get some national perspective. For those of you who are not familiar with David's research, he has worked with Peter Buerhaus and Doug Steger for many years on conducting national and regional estimates of future supply of registered nurses, and they've even done work on future supply of advanced practice nurses. So David, I hand it over to you.
Okay, so these are a few slides where I will be showing some results from our forecast model applied to just California. Fortunately, it is a big enough state where we have enough data to do that fairly well. And we won't be able to do sub-regions within California, but at least what we find is that the overall results do appear consistent with other forecasts of California's nursing workforce. So a note about the data that I'll be using. This is a cohort model. What it's doing is we combine many years of data, in this case, census data from 1979 all the way through 2017. What the next slide is going to show is a paper that results from an article we published a couple of years ago in Nursing Outlook, where we applied our forecast model and we divided the country up into 9 regions. And we ran this forecast on data up to the year 2014, which we had at the time. And what we show there was that there are wide variations in different parts of the country as to how fast we expect our nursing workforce to grow between the years 2015 and 2030. And for example, New England is expected to have almost no growth per capita in their nursing workforce. So in each pair of bars, the ones on the left are the published results where we showed, where we had data up through 2014. And you can see that in the Pacific region on the right, which includes Alaska, California, Hawaii, Oregon, and Washington, projected growth was also quite low, almost no per capita growth in the workforce between 2015 and 2030. And then what we did was, with 3 additional years of data, we haven't published this, but we reran the model, now with data up through 2017, and again projected growth between 2017 and 2030. And most regions had a relatively similar rate of growth in the forecast, but in the Pacific region, we noticed there was a big jump. And so we wanted to dig a little more into that, and especially for this webinar, to see if this is mostly due to California. Okay, next slide. And it turns out it is. So to give you a little intuition into what's happening, this is just showing the breakdown of the California RN workforce by age group. And we're showing this in 4 different years. For example, if you go way back to 1980, you had this interesting phenomenon of the baby boom, whereas on the very left of each set of bars, you see, for example, age 25 to 29. In 1980, that was the biggest group of nurses. There were more 25 to 29-year-old nurses than any other age group because of those baby boomers who had entered in huge numbers. In the year 2000, the biggest group was those same boomers who were now in their 40s. And then if you go to the blue bars for 2014, you can see what the workforce looked like then. And between 2014 and 2017, just in those 3 years, where I'm circling in the red, you see a big increase in the number of 25 to 29-year-old RNs and the number of 30 to 34-year-old RNs. And this is consistent with what Joanne showed earlier with that big increase in graduates from California in those years. So there's a big surge in entry in California between 2014 and 2017. Okay, so in the next slide, you'll see that reflected in this difference in the forecast. So what we're showing here is California number of RNs going all the way back to 1979 through 2014. That's the green dots with the line. Now, when we do the forecast and we only have the data up to 2014, that's the green dots on the lower part going out to 2030. And you can see that forecast resulted in an estimate of about 316,000 RNs in 2030. Then we update the model. We say, well, look, in the years 2015 to 17, that's the actual data in the blue. There were more RNs than the model had predicted. That was because of that increased entry in those years. We rerun the model using all of that data, and not surprisingly, the forecast improves. And you can see now we're projecting about 348,000 RNs in the year 2030. So just those 3 years of data has increased the outlook by about 30,000 RNs. Okay, final slide. So Joanne arrayed here our forecast along with a number of others to just show the comparison. And what you see on the supply side is 3 forecasts, which really are using entirely independent models, are in rough agreement of the number of California RNs by 2030. And the SPETS forecast is partly below the others because it has a lower estimate in the baseline of the number of RNs. So it's starting about 20,000 lower, and it ends up about 20,000 lower. So it's really roughly the same growth, and it's just a difference in assumptions in the beginning. So if you compare those numbers of around 340,000, 350 to what folks are estimating on the demand side, which we don't do in our model, those are also quite similar. So you see a workforce in 2030 that's expected to be roughly in balance, even with very different models and methods being used. And one difference being that that forecast listed there below, the Zhang et al. Model, and a main reason that they're getting a very different result, which is a large shortage, is they're really using a fundamentally different approach where they are saying, well, we think even in the starting year, in the very beginning, California has a big shortage because they have fewer RNs per capita than the rest of the country. So we're going to call that a shortage and then say that that isn't going to change by 2030 substantially, so we're going to end up with a shortage. But that's really doing a very different thing, and that's making it's not comparable to the others. I think, would you agree with that, Joanne?
Yeah, I would agree with that. I think understanding how California compares to the national average is interesting and is useful for just seeing where we stand. But then California has never employed anywhere near the national average. Not that I'm sure we couldn't use those nurses, but we have a very efficient healthcare system and a relatively healthy population. So there's no evidence that we need that many nurses, or even if they were around, that employers would hire them. As it is, employers think we have a surplus of new graduates.
Right, exactly. Okay, so we should all take that number with a grain of salt. So I'll just add that, so a consistent story that seems to be emerging is that the overall numbers look roughly in balance, but there is an imbalance in what employers seem to be wanting and what they're finding in the workforce. And we hear this in Massachusetts too, that you have a lot of very experienced baby boomer RNs who are leaving the workforce, and employers wanting to replace that experience and having a large pool of new grads who don't really have what they want, and sometimes they're they're either keeping those vacancies open or turning to traveling nurses, and you do have somewhat of a disconnect in various parts of the market. Okay, so I'll turn it back over to Joanne there.
Well, thanks. David just said largely what I think we all are concluding, and this is a national issue as well as a California issue from what we can tell. Across California, statewide, the forecast suggests that there are balanced labor markets. Almost every forecast is coming up with similar results. And the one that would suggest we have a shortage is really based on comparing California to a national average that we've never had for demand, and I would argue probably never will have. So that said, there are still important regional differences, with some areas of the state facing surpluses and other regions of the state facing significant shortages, particularly with the Central Valley and Central Coast regions facing shortage. This suggests that education expansions should be regionally targeted, and we also are hearing that employers are particularly concerned about experienced and specialty RNs, as David said. So are they turning overseas for that? They might be. Maybe this explains the rise of endorsements from other states, is that hospitals are recruiting nurses from other states to fill those positions that baby boomers are leaving. And we are seeing that more employers are requiring bachelor's degrees, primarily in urban areas, but it is still less than 20% of hospitals that are requiring the bachelor's degree. Now, I'm going to turn it back over to Garrett because he's been working with a group of people, including Terry, on an approach that's been used to address the shortage of experienced RNs in one particular region.
Thanks, Joanne. So I assumed the president and CEO position in January of this year, and I'm going to be reporting on some work that was done last year by a group of great thinkers, Terry Hollingsworth and Lisa Mitchell from the Hospital Association of Southern California, Judy Berg, the previous CEO of HealthImpact, Carolyn Olowski, who's a project director, and Mary Lynn Knighton, who's also one of the project directors on HealthImpact. This particular collaborative between the Hospital Association of Southern California and HealthImpact wanted to look at the concept of a regional need. Specifically, how do we address the shortage of one particular specialty, perioperative nursing, in a region that within the HASC region, or the Hospital Association of Southern California region. Now, the Hospital Association of Southern California spans 6 counties. They are Ventura, Santa Barbara, Los Angeles, Orange, Riverside, and San Bernardino counties. And even within that region, we wanted to focus on a very specific area, which is the area known as the South Bay region, which is kind of in the Los Angeles, Orange County area. And HealthImpact and the Hospital Association of Southern California applied for a grant with the South Bay Workforce Investment Board to do a demonstration project on perioperative nursing and specialty training. We partnered with 2 local universities to create a educational curriculum and experience to help accelerate the learning for perioperative nursing so that we can help fill these vacancy needs. Now, in the planning of the demonstration project, there were a few things that were considered as the specialty of perioperative nursing was chosen. So one thing that we know is that we have vacancies within hospitals or any health system or even a community clinic. So the vacancy number only tells part of the story. There are other indicators that we considered and we continue to consider as we think about how to provide resources for education and training to meet this supply of new grads or nurses with the experienced nurses that health systems need. The other components of things that the other metrics that we considered were metrics from HR, like time to fill. So if a particular job vacancy is hard to fill, usually it takes many months for a recruiter to put or hire a new person into that position. And so we know that perioperative nursing is commonly classified as a hard to fill position, meaning that it takes a longer time for a recruiter to put an applicant into that position to become an employee. The other thing that we consider in terms of how do we figure out the resourcing around improving the pool of experienced nurses in these specialty areas was the average age that we know of different specialties. And the American Perioperative Nurses Association has been following the average age of perioperative nurses very closely, because they sense that the average age of a perioperative nurse is higher than the general population of RNs. And so with these thoughts in mind, we created this perioperative nursing demonstration project. And so the next slide just talks about some of the outcomes of this small demonstration project in partnership with the South Bay Workforce Investment Board. So we were able to educate and train 17 nurses to fill critical vacancies. We had 5 new grad RNs and 1 unlicensed new grad in our cohort. We had 100% pass rate at 80% or greater of the American Perioperative Registered Nursing Association Periop 101 exam. The ARN 101 skills checklist and the QSIN competencies were addressed and highlighted in both the education and training of these learners. And 1 hospital provided promotions and salary increases as a result of being part of this program. We found some qualitative outcomes where the respondents to our qualitative survey responded positively, both from the learner perspective as well as from the employer's perspective. As a result of this particular project, Carolyn Orlowski created a return on investment calculation to show that an investment in nurses going to this program would actually save the hospital monies in terms of overtime, use of agency or traveler staff. And so that return on investment tool will become available on the HealthImpact website in the coming months. And then we also had some learnings around how to educate and train these nurses to a new specialty. So I wanted to share this exemplar to show that how we can interpret the data and also be attentive to the local needs and regional needs of employers to create meaningful educational experiences to pick up the practice of a particular specialty so that the patients can get high quality and safe patient care. So I'm going to turn it back over to you, Joanne.
Great. Just to let everybody know, first, this webinar is being recorded, so we'll be posting it online. And you will be finding on our website, I believe right now, we have some of the data that was presented in this webinar. Some of that data is provided in an interactive web display so that you can look at the data that was presented today from the CNO survey with some regional information that you can click on and look at. You'd want to click on the demand data tab for that. So this is an example of what these maps have looked like over time. You can identify a region, and then you can look at what the demand for RNs appears to be in that region. You also can go to the Board of Registered Nursing website, where they publish in their reports section the annual school reports, the biennial surveys of nurses, and the forecast reports that are produced for the state, as well as other RN-specific surveys and reports that they commission. And of course, HealthImpact's website has a whole variety of additional reports, data, and survey results that they're involved in. And we all try to cross-link with each other to the extent that we can. So there are a number of questions that came in by email, and then also we know that people are typing in questions as well. But I do want to get us started with some of the ones that came in with the registration process to make sure that we answer at least some of those. The first set of questions were around the distinction between associate degree nurses and bachelor's degree nurses, that the data available doesn't really distinguish demand and supply for those populations, but we do see that about 20% of hospitals are requiring bachelor's degrees, and more than that, an additional 50% or more prefer it. So first, where do we see, or where do we have a sense that those shortages or the need or desire for bachelor's degrees might be greatest? And then what are the best opportunities for new graduates who have associate degrees? And I'd love to get Garrett and Terry's feedback on that question.
Garrett, would you like to go first?
Terry, I think maybe if you can start with the hospital, then I'll go into the general.
Right. We're in terms of utilization based on degrees. We haven't captured that through our survey. So it's I really don't have any information or research to be able to respond to that. But that's something that we should probably explore further.
And what I would say is that given the data that we've seen for California in general, HealthImpact and other organizations are trying to create this articulation into the BSN programs with the associate degree programs. And one really outstanding example of that would be a model that Riverside City College is doing in collaboration with the California State University Fullerton and the California State University San Bernardino, where there is concurrent enrollment in both the ADN program and the BSN program. And they're doing some phenomenal work, and we will hear more from them as they continue to work out the program and disseminate it and try to implement that across the state. So I really think that their work has been fantastic. And I would also say that the associate degree program directors and faculty are really taking to heart that how they communicate with their students about the value of the BSN and how that plays a part in the ADN's, the nurses' practice as well as job opportunities. And I think right now we're seeing a great collaboration between the associate degree faculty and the BSN faculty in advancing the educational pathway and progression for nurses in California.
Thank you. I think that those pathways are incredibly important, and it really, in the modeling that I do for forecasting, and I think David would have a similar experience. There are so many jobs for nurses where the employer might prefer or place more weight on the nurse's experience, their attitude, their basic knowledge, and their interest in lifelong learning, that the entry-level degree may not be as important for the vast majority of jobs as the skills and the attitude of the person that you're hiring. And I think many of us probably can reflect upon that. Many of us maybe in our own jobs have had experiences where we have hired somebody who did not have the academic credential per se that might have been desired, but they had the skills and the attitude to really be great at their job. which makes it impossible to explicitly distinguish them from a forecasting or a modeling standpoint. So there have been a few questions that have come in around nursing shortages and inpatient and outpatient about where there might be greater shortages. Terry Hill posted a question in the chat about whether we have data specific to, for example, long-term care and rehabilitation and demand in those settings. Unfortunately, we do not. We have had not much luck in surveying those kinds of facilities. We do know from the supply side that a growing number of new graduates appear to be getting their first jobs in long-term care types of settings. And we know for shortages that employers are more often reporting that they are having a hard time recruiting into, to some degree, care management, but more heavily into intensive care, perioperative, labor and delivery, and those kinds of departments and units. So there's another question about clinical training access and how the lack of clinical training spots might be affecting nursing shortages in regions, and whether, and I would imagine that that applies as a question both to the ability to onboard nurses into the specialty departments where they're most needed, as well as for in shortage regions to expand nursing education when hospitals may not have the clinical training capacity for them. Terry and Garrett, any thoughts on what you're seeing around clinical training spots and access and how that can help support meeting the needs in areas that are having a harder time?
Right. Through our work in examining and addressing the specialty RN shortage, we have heard from our member hospitals, or we've heard from schools in particular, about the lack of clinical placement spots. And I think through the work that Garrett just described in terms of the, there's a model that will come from this pilot program that Garrett just described. Our goal is to create a more coordinated and collaborative type of a model that will hopefully address not only the training of the specialty RNs, getting more RNs trained in these specialty areas, but also to ensure that there's a better collaboration and coordination with finding clinical spots within hospitals. So that's where we're headed, because we see a great need for that. We've heard from our schools about their frustrations with not being able to find enough clinical spots, and so that's definitely part of the work that we're looking to address. So Garrett, I'll pass it over to you, and you can dig deeper on that.
Yeah. So we know that this is an issue across the state of California. There are some areas where it's not an issue, where there's collaboration and coordination among clinical sites for academic institutions. One of the things that I would draw our attention to is that about 40% of new graduates are finding employment outside of the hospital, inpatient units. And so as we start thinking about finding meaningful clinical placements and how do we create an educational curriculum that could help meet the supply needs, the demand needs for highly qualified, educated nurses in pre-licensure programs, we should think about expanding our different clinical partners in areas that where our graduates are finding jobs, because we want to prepare these student nurses to competency in a wide variety of different settings. And so given the high or strong focus on social determinants of health and public health issues, we may see a rise in opportunities for nurses that are outside the traditional acute care settings. And so my recommendation is to continue to work with partners. I understand that there are logistical issues that need to be worked out on the academic side about where and how to place students and how to supervise. But I think that these data show that we need to think about additional clinical settings to send our students to so that they can pick up and learn the practice of nursing.
Thank you. Now for our audience, I know that we are a little bit over time, but I believe that we as panelists have a little bit more time available for you. So there are some more questions, and I know I'm happy to keep going. Garrett and Terry and David, do you have a few more minutes?
A couple, yep.
Okay, and David, I know may have other meetings coming in on him sooner than Terry and Garrett and I do. So another question that came in that I can speak to a little bit, and Garrett and Terry may also have some perspective, is, and David as well, is there's a question that says, are we retaining nurses who are mid-career, or are we replacing that knowledge and experience base with less experienced nurses who are not being mentored and then leave the profession? So I think this is a question about the degree of churn there is. And this relates back to the question that a question came into Terry about the data that she mentioned of 42% turnover of new graduates. Now I can say what we see in the data is that the new graduates might change jobs, but they generally don't appear to leave the profession. Right. The rates at which they allow their licenses to lapse are very, very, very small. And the percentage of them working tends to be extremely high. So just because they left your job doesn't mean that they left the profession. That said, there is a life cycle of kind of movement of nurses from more generalized roles into more specialized roles, and then sometimes into outpatient settings and home health and other type settings over the course of their careers, which does mean that I think a lot of hospitals feel like those generalized acute care positions that are so important to the role of a hospital are constantly being refilled with people with less experience, because the more experienced nurses move on. This is a workforce challenge that it's hard to address from the outside, and really it's an issue that employers are going to have to think about how it is that they want to reward the generalist nurse as well as the specialty nurse. Any other thoughts on that, Garrett and Terry?
Yeah, and Joanne, I had actually posed a question to our nurse executive listserv, looking at the other end of the spectrum, looking at the older, more experienced nurse. I wanted to know from our member hospitals if they've implemented any retention strategies to help retain the knowledge and experience of the older nurse. And I wanted to share with the group one of the strategies submitted to me, and I have others that are coming in today, over today and tomorrow. And this one hospital said that we have found that by offering half shifts or 6-hour shifts and giving opportunities to be mentors or educators, we have been able to keep some of our more experienced nurses longer. So they're shortening the shifts, and then they're giving them mentorship and educator opportunities to help retain some of the more senior nurses. So I just wanted to share that.
That's a great story. I think that connects very well into the next batch of questions we received in the registration process, which were around nursing schools and the challenges that they may be facing around faculty shortages, strategies that they might use to recruit more faculty and have more equity in salaries, and also challenges that they may be facing in onboarding new faculty hires who do not have the academic experience and are maybe facing challenges learning the ropes about being nursing instructors and faculty and teachers. Garrett, I'm guessing in your role you have more exposure to this than I do, certainly. I'd love your thoughts.
Sure. So as a result of a grant that HealthImpact received, we created a core curriculum to educate nurses who might be interested in clinical faculty positions. And so the curriculum has been piloted a few different times over the past few years. We're looking to do perhaps one more revision and make it available so that we're able to help educate and train the clinical faculty to pick up the role as a clinical faculty member. There are certain things that the person who posed the question brings up that are perhaps out of our control at this point in time, which is faculty salaries. We know that there are certainly barriers to faculty salaries, and increasing them to be on par with hospital or health system-based nurses. But we're still looking at various options and thinking about what can we do. There was and I apologize, I don't exactly know which state it was, but there was a recent state that allowed faculty to have a tax deduction in their state taxes if you were a nursing faculty, and that might be a strategy. We have this on the radar as something of significant concern, and starting to think about strategies to address all of the reasons why and the barriers, frankly, of why people are not entering into a faculty position. So please stay tuned for more information.
Thanks, Garrett. Now, there are a couple of questions that came in specific about the nurse practitioner workforce. And we didn't really present any data on that, but we would encourage you to look at a couple of different sources of information. One is that the California Healthcare Foundation published some informational documents about the NP workforce in California, scope of practice in the state, and how it compares to other states. So if you just Google California Healthcare Foundation nurse practitioners, you will hit those briefs and that information, which also includes some data about the NP workforce in California. The Board of Registered Nursing published a report about a little over a year ago about our state's nurse practitioner and nurse midwifery workforce. And then the California Association of Nurse Practitioners is a treasure trove of additional information. So we encourage you to look at their website as well. I think that'll help answer your questions, and other questions you have, you can certainly email us and we'll see what we can help you find. There was also a question sent in about the demand for LVNs and what that's looking like in California. That really wasn't in our forecast and hasn't been in the past. But Terry, what are you seeing among hospitals and other work settings about demand for LVNs?
Yeah. So in our data, in the hospital data, we showed an increase in hiring of LVNs, but again, they're not necessarily, some may be utilized in the acute care setting, but for the most part, what we've been hearing and seeing is that they are being utilized in other non-acute affiliated units within that's part of the hospital. So it could be home health, it could be some of their non-acute care units where the LVN is being utilized.
Great. That's consistent with what I'm hearing, and some of the national work that we've done has shown that the greatest growth in LVN demand right now is happening in long-term care settings, particularly home health, which you referred to about LVNs getting increasingly hired into hospital kind of ancillary types of departments such as the home health or rehabilitation services. Mm-hmm. So that's very consistent. Yeah, LVNs are not hired as much in acute care in California, partly due to scope of practice regulations in our state, but there is a healthy labor market for LVNs, and it's also a great opportunity for a person to get into nursing work early in their lives or their careers. And if they love it, then they could pursue a nursing degree subsequently for registered nursing, or many people love their roles as LVNs and stay in those jobs for their entire careers. So it's a great opportunity to be a nurse. Most of the other questions that have come in, we have answered, I think, in the slides and have discussed in other cases. There's one last question that I think we haven't answered, and we'll do our best with it. Terry, the vacancy data indicated that there was a decrease in vacancies for aides in the most recent survey, after a bit of a surge in demand for aides in the, I think it was about 2015 or so. Any thoughts about what might be underlying that?
Well, you know, again, I think in that category contains certified and non-certified aides, and we recently conducted a utilization survey for the Chancellor's office to find out how some of these aides are being used. And, you know, I think that's the hospitals are going through the process of determining how to best utilize that category of certified and non-certified, you know, category there. So it's not clear. You know, sometimes we see them serving as sitters, patient care representatives. It's a variety of different uses among those aide positions. So it's something we're going to have to explore and watch a little bit closer.
Thanks much. Well, thank you for those of you who have stayed on as we have gone over time, but we really have appreciated your questions. You are welcome to contact any of us, and keep an eye on our websites. If you are on this webinar, we will now put you on our email list. The webinar has been recorded, the slides will be posted, and there are a whole series of reports that all of our organizations release over time. So if you're on our mailing list, you'll hear about the latest data that we produce, and we also will keep you apprised of the latest work that, that David Auerbach and the team that he collaborates with produce as well. So thank you very much for joining us, and we hope everybody has a great day. Thank you.